And here we go. Welcome everybody to another Big Ideas. I am your host, Dr. Jeffrey Hanna with Clear Chiropractic here in Spokane, where we talk about all of the big ways that a little problem right up at the very base where your skull meets your neck can show up in a number of different ways in your body that people don't even realize, but also how a very simple and powerful solution can help people live so much better quality of lives. And in this particular video, we're actually going to be talking about how a little problem in the upper part of your neck can show up and manifest as a lower back issue. And what I'm going to be showing you is a case that I had the pleasure to work with a few years back. In brief, this was a younger person who didn't have whole amounts of degenerative arthritis yet through their spine. They were fit, they were healthy, they took good care of themselves, and yet they were experiencing most debilitating lower back issues. They'd had standard CTs, they'd had MRIs, they'd had even normal x-rays, and everybody said, yeah, we're not really seeing anything is wrong with you. And so she had tried all of the customary therapies. She tried physical therapy, she tried massage, she tried exercising, and we figured, okay, it's possible that where the problem is isn't necessarily where the problem is. In other words, there's a difference between the effect, the lower back pain, but maybe it's coming from somewhere else. So what we did is we went through our normal kinds of tests, procedures, stuff like that, and realized, okay, yeah, we've got an issue right up at the top of the neck there. So let's go ahead and see what would happen if we were to start treating and addressing there, because she'd already had all the lower back stuff done. So what I'm going to show you here are a couple of her x-ray films, both pre and post care. It's pretty exciting when you see what we'll come up with. All right, so here we go. Here's the first picture that we are going to showcase. And what you can see, this here is going to be a representation of her lower back. So these are the individual vertebrae coming back like this. This is the top of the hip bone. This is the hip joint right here. Now, we've also got the markers here. So this is the left side. This is going to be her right side. So we're as if looking at her from behind. This little thing right here, note this is not anything that she'd swallowed. This would just simply be a belly button piercing. And then what I'd always take in my films, because it never really blocked the anatomy that we were looking with, didn't make person gown or anything like that. So zipper right here. And I think that you can see, looking at this picture here, the notable asymmetry, that you're looking at the vertebrae, they do not appear to be the same on the left side versus the right side. If you're looking at the basically alignment, relatively speaking, through this part of her lower hip bones, everything looks like it's essentially twisted like this. And it's a really common expression that people use. People say, oh, you've got twisted hips or a twisted pelvis, and that's what the problem is. Well, yes and no. See, the pelvis, the way it's constructed, is something like this. So it will torque and turn on itself like that, but in and of itself, it doesn't truly twist sideways. If anything, it has a tendency more to shear like this. And it usually does so as a compensation for stress either below, that is a problem with your foot, or a stress above, oftentimes a problem with the neck. So one way or another, we can take this picture here and we can look at this and say, yeah, we can definitely see where this strain is going on through your body. In other words, yeah, there's more than enough reason, why she would be experiencing discomfort here. Now, I'll repeat what I had said earlier on, and that was she'd already had all kinds of therapy directed for her lower back. And when I was looking at these, I made sure that her hips, relatively level, base of her sacrum, so that is the foundation of her spine, pretty level. I checked the motion. Everything seemed to be moving pretty good. In other words, all of the tests were saying this is not where her problems are actually originating from. It just so happens to be that this is where she's bearing the brunt of it. This is where she, quote unquote, is holding her stress. And your body is designed to win. We're born perfect, 100% life capacity. But over a period of time, when you accumulate all of the stresses into our muscles, our ligaments, our nerves, our bodies, as resilient as they are, can only compensate for so long before eventually something's going to give. So the problems then that we oftentimes attribute to too much stress, too much work, too much getting older, all of these things. We put them down to that when in reality it's like, no. There's an underlying issue with their body that we don't realize what it is. And now it's starting to show up when it's reduced our capacity to be able to handle that stress when we reach a certain threshold. Now, I will also add here, just so that everybody knows, because some people, would say, okay, Jeff, you sure that you actually lined her up and that wasn't just the way that she was standing when you took the film? Mm-mm. I made sure when I take all of my lumbar films that a person is properly calibrated to the middle of the film with their feet standing exactly the same width apart from a midline and relative to this other. In other words, the quote-unquote twist that we're seeing here is not a positional artifact. This was the orientation of her low back in that moment when we took this picture. Okay, so here we now have looking at this person's neck. And we're looking at the skull on the side profile, teeth, face this way, the C1 vertebra, C2, 3, 4, 5, 6, all the way down through 7. And what I think that you may notice here is that each of these vertebrae is stacked on top of each other effectively like this. The normal neck is supposed to have what's called a lordotic curve. In other words, it's supposed to be shaped kind of like a backwards C, something like this. And when it straightens out, it's oftentimes attributed as being muscle guarding, muscle splinting, or position when the x-ray was taken. Again, that is not the case. When the neck starts to straighten, it's a reflection that there is some kind of abnormal tension on the muscle, the ligament, and ultimately on the nerve. And so by looking at the curve of a person's neck, you get, if you would, a snapshot of the health of this person's spine. And we also know from a anatomical standpoint, if I'm looking at a person's neck where it's way too straight like this, that you've got the spinal cord on the inside, which you can't see because an x-ray shows bony tissue, but we are effectively a loose piece of string anchored at the top of the base of the skull here, the C1, 2, and C3 vertebra, and then everything is freely floating all the way to the bottom at the sacrum. So if you lose the curve of your neck because of a physical injury, namely a whiplash injury, what it's going to do is it's going to have the effect of taking that piece of string and pulling on it like this. And if the tension is coming from the top, yes, very common that people will experience headaches, migraines, vertigo, but it's also very possible, but what they're going to start to do is they're going to start to experience pain down at the other end because they're feeling the tension. And if you take an MRI of a person, 85% of everybody has bulging discs through their lower back. The thing about it is your spinal cord itself actually ends kind of in the small recess of your back. And so oftentimes, even though those discs can irritate some of the nerve rootlets, that in and of itself does not account for why so many people experience lower back issues. Now, granted, yes, if you can have massage, exercise, physical therapy, acupuncture directed straight for your low back, and it helps with the problem, beautiful. Where the problem was where the problem was. But if you've had treatment for your low back, and unfortunately it's not getting any better, that is a hallmark then that the problem is most likely coming from somewhere else. And I want you to bear in mind the tension of that string. And also what this straightness through this person's neck is actually going to represent and what it illustrates. In other words, it ain't just a neck problem. It's a neurological problem that manifests and can show up in a health problem, which is a life problem in any number of different ways. So this is what we saw. We took a few additional views so that we could figure out exactly how did her individual joint angles fit together so that we could figure out what was then going to be the most appropriate form of treatment that we were going to do for her. So what we did is we said, okay, you've already done all of the stuff down through your lower back, and she kept doing all the exercises that she was prescribed. And I actually recommended that she did that because a lot of times when people are given low back exercises, they are the right thing, but oftentimes in the wrong order. It's trying to solve a combination lock. You need the digits in the correct sequence, otherwise the thing doesn't work, even if all the numbers are correct. So she kept doing all of the physical exercises that she had originally been given, but the difference is that we started focusing on adjusting her neck, and that was the only part that I was actually adjusting on her. And it took a little while for her to reverse some of that momentum. It probably took the better part of around 3 weeks or so. But when she hit stride, I'll say she started doing and noticing her flexibility was coming back, and she wasn't having near the pain as she was sitting or doing her other kinds of, work activity. It was going really, really good. And I don't normally do this, but at the 6-week mark, what I decided to do was I decided to redo her films. Part of it was my own curiosity, but the other part of it was as I was palpating her neck and her back, it just felt remarkably different. And I wanted to have a look and see what was going on. Now, I'll reiterate that what I'm going to show you next here, this does not happen for every single person. Why? Because when people have a certain amount of degenerative arthritis, we can't undo that physical damage. But it nevertheless illustrates that if you can increase the motion through the system for what is normal for that person, if you can enhance and improve their flexibility, if you can get their alignments and their motions to heal, to strengthen, to stabilize over a period of time, the body has an amazing capacity to do amazing things. So let me show you now what we saw on her pre and her post x-rays. Boom, right here. What we have, this was her original, this was her post. And yes, I was slack. I didn't make her take off her necklace or her earrings because I wasn't analyzing for pathology. I was looking for evidence of biomechanical change. This illustrates the example of that nice, neutral, natural neck curve that we like to see. Again, a person could say, oh, Jeff, you deliberately changed the position of her head when you took these films. No, I didn't. I give people the same instructions. Sit back in the chair, nod your head up and down, and bring it to whatever feels normal and neutral for you. So the changes that we were seeing here are not reflective of how she was sitting in the chair when I took the pictures. This is a change of how her body was able to make the healing changes on its own simply by releasing those areas that were locked up in her neck. And because she so happened to not have all of the horrific marks of a degenerative arthritis, and because she didn't have any other areas in her spine that were causing an issue, her body was able to untwist from all of that stress on its own. This is what we love to see all day, every day. Again, I'd be lying to you if I said that this was the case for every single person, but this is to show you what is possible. But it doesn't stop there. This was her neck. I also wanted to see what was going on through her lower back. This is what we saw. And look at that. She went, and again, I was very pedantic about this to make sure that we had everything properly lined up. She's standing, whatever is believed to be neutral. You can see the same piercing, so it's the same person. She was wearing, obviously, different set of jeans or something on that day. But that curvature, that twisting that was going on, that torquing through her lower back, in and through the pelvic joints, in and through the pubic joints, in and through the hips, it was almost all gone. And so I illustrate this and I repeat, I did not once adjust her lower back. This illustrates then that assuming there's nothing else going on, if you can untwist the problem that's going on in the upper part of the spine, the body has a much better ability to untwist all of these other issues on its own. Now, yes, a person can have independent problems going on through here. I'm not saying that that doesn't exist. Of course that exists. But if it's not there, or if that is not the actual origin of the discomfort that a person's feeling, you can have all the low back treatment in the want. It's not going to solve it because, again, that's not where it's coming from. But if you actually identify this is where the origin is, this is where the cause is, you can see amazing things happen through a person's body as the body untwists, releases that tension, and then gets back to that normal, flexible, strong point of equilibrium. So that's the power of what working in the upper part of the neck can do and help people even when they're experiencing pretty chronic, pretty debilitating lower back pain. So there we go. Again, I'd love to say that that was every single case of lower back issues we've ever seen, but that would not be the case. But again, highlighting what is possible when you can unlock what's going on at the top and let your body do the healing magic the way that we were all born and designed to be able to do. Hope you've enjoyed this video. If you have, per the always, please do click the like and subscribe button. It'll help the YouTube algorithms recognize that this is a useful video so that other people who need to find this information are able to do so. If you've also watched and you're thinking, I actually have a family member or friend who would benefit from watching this, please share this video with them. And last but certainly not least is if you've identified yourself, you've got some stuff going on here and you want some more information about what we can do to help you out, would recommend go over to my personal website, which is drjeffreyhanna.com, where I've got links to all kinds of other articles, blogs, videos like this that explain to you just a little bit more the power, the influence of the upper part of your neck showing up in health and life situations, ways you may never even realize it. And if then, of course, you are in the Spokane or the Eastern Washington, Western Idaho area and thinking, okay, we need to see what we can do to help you out, reach out to us at our practice. I'm part of the member of the team at Clear Chiropractic. You just go to clearchirospokane.com. You'll find all of our information, 2 locations at the South Hill and in the north at Mead. Our office number 509-315-8166. Reach out to us. We'll be happy to help, have a conversation, and do everything we can to help improve your quality of life. Thanks for watching. This is Dr. Jeffrey Hanna at Clear Chiropractic. Get well, live well, stay well, and take care until next time. Bye-bye.